Well, can the Democrats' plan solve the nation's health care issues? That's the subject of our face-off debate here tonight. Joining me now, Douglas Holtz-Eakin. He is the former director of the Congressional Budget Office, a fellow at the Manhattan Institute. Great to have you with us.
Thank you.
And Maggie Mahar, she's fellow at the Century Foundation, also author of Money-Driven Medicine, the real reason healthcare costs so much. Good to have you both with us. I mean, my God, that's a transparent deal, apparently, between the leadership of the democratically led Congress and the AMA.
This is a non-story. I have to say this. This is a non-story because everyone knew there was not going to be a 20% cut across the board in doctors' fees. That's not what they're talking about when they talk about Medicare cuts. Why do I say this? Because the president's budget at the very beginning of the year did not include those cuts. Each year before that, President Bush's budget each year would include these cuts that we were supposed to be making in doctors' fees under Medicare and that Congress was never willing to make, but they were always in the budget. This year, Obama said, I'm not going to put them in the budget because I know that we're not going to make those cuts. And he knew this is a very crude solution to health care spending. You don't want to whack doctors' fees across the board. Some doctors are underpaying.
Especially if you're trying to get the AMA to go along with your deal, right?
Especially if you're trying to improve health care. If you cut primary care fees, you're going to make it harder to find a primary care doctor. And that's a bad thing for patients. What we need to do is cut the fat out of the system with a scalpel, not with an axe.
All right. Doc?
It's $250 billion real dollars, and it's real money, and it is typical of this health care reform that's going to lead to an enormous amount of debt on the federal budget, and we're going to leave it behind for our kids. So I think it's important to move from the theory of what health care reform would have been to what these bills actually contain. And these bills do not bend. Let me finish.
I'm sorry.
These bills don't bend the cost curve. They don't fulfill the promise of quality care at a lower cost, but they do have immediate higher costs. $200 billion worth of fees and taxes on the industry that we passed on to consumers. $200 billion in excise taxes can be passed on to consumers. We know that nonpartisan sources like the Joint Committee on Taxation say 90% of that's going to be on the middle class. So we get increased costs, no real health care reform, and a pile of debt at the end of this.
I'm afraid that if you read the bills, that just isn't true. First of all, the charge for Cadillac insurance policies is only in the Senate Finance bill. It's one of the least popular provisions in that bill. Yeah, that one.
This one with 1,502 pages.
Yeah. I've read it, actually, you know. It's what I do for a living. I have to. I've read it because it's what I have to do for a living.
Wait a minute. Yeah. You read this?
Yes.
When did you read this?
Online. I've read it.
No, I say when, not when.
Oh, I've read it several times as it evolved. Probably
because you had to have a running start.
Yeah, yeah.
Because by our calculation, reading each page in some detail would take you at least a week.
I'm a fast reader.
I know you are, and you are obviously a great deal of stamina. But John Conyers doesn't have that kind of stamina nor interest. And frankly, we couldn't find a single congressman or senator who expressed a great lust to read it.
But you know what? Behind every senator and congressperson, there is someone on staff, usually a woman, who has read it. As a reporter, you know that. When you call, you don't want the senator, you want the person on staff who actually has the facts. And the facts are...
Well, why don't we just let them vote then?
Well,
do you realize what you've just said? You've just basically said that the Congress of the United States is comprised of absolute idiots because they are relying on staff for a document of 1,502 pages to make a determination whether or not they should read it.
No, no senator could read all of the bills. Let me just say that.
We know they don't read them. They don't read 95% of the... Excuse me.
Yeah, I'm sorry. Go ahead.
They don't read 95% of the legislation.
I'm sure that's true.
Well, that's...
But the point I was trying to make is you're talking about the Senate Finance bill. There are 3 bills at least on the table now. Senate Finance, Senate Help, and House. Only one of them has the taxes that you're talking about on Cadillac insurance plans. The House bill would raise money in 2 ways. First, by cutting unnecessary, hazardous treatments under Medicare. Medicare's already started doing that. They just slashed fees for MRIs because they know we're getting too much radiation, because the number of MRIs doubled since between 2000 and 2007. The other thing the House bill would do is it would raise taxes on the wealthiest 1.5% of all Americans. Those Americans have seen their income go up 232% since 1975.
Doug, you're going to have to jump in here.
Let's be clear.
Okay.
The House bill, very clearly the CBO said, did not bend the cost curve and added to the nation's long-run deficit. It failed, let me finish. It failed that test. The Senate bills grow at exactly the same 8% rate as the House bills. They failed the same tests. They've simply disguised this fact better. It's about $1 billion a page, quite frankly, by promising to do provider cuts that you just said are undesirable and bad for medicine for a decade in the future. So they will leave behind for our children a bigger entitlement problem, no reform to our healthcare system, and a pile of debt. And so that's not a good route for this country to go.
CBO Director Douglas Ford was pressed by Republicans a few days ago as to how much these bills would, specifically the Senate Finance bill, would add to the cost of health care. And he said, there is no way we can estimate that. I'm quoting. This was quoted in the Washington Post. He said, there are so many conflicting variables involved.
It was also noted in his assessment of the concept by the Senate Finance Committee. A lot of news organizations chose not to pay attention to it. What you've effectively said is no one has any idea in the world what we're talking about.
That's absolutely right. CPO markups, we all know, are traditionally off.
Well, rather than getting into a history lesson or an institutional analysis, the fact is we have legislation here that everyone is talking about as being $829 billion when
no one knows.
When the Senate Majority Leader is using the number $2 trillion on the floor of the Senate.
Lou, if 1999 you sat down.
And you know that. I mean, this bill is well over $1 trillion because they've disguised it by taking the doc fix out.
How do you know it's well over $1 trillion?
That's
no one
easily the case, because if you look at the history of CBO, which I actually know a little bit about, right, you'll see that they typically underestimate bills that are heavily reliant on government programs. The only place we've overestimated a cost was in the drug bill that was under my tenure, which used a competitive bidding mechanism. So if we wanted to really do healthcare reform and make some progress, we would actually employ some genuine competitive bidding more broadly in Medicare, lower the bill for seniors and for taxpayers, but that's not what we're doing here. This, unfortunately, is not healthcare reform. This is a large exercise in taxing people in disguised fashions to write checks, and it's not an improvement on the system we have.
There's no tax on the middle class in the House bill. There is no tax on the middle class in the Senate Finance bill unless you believe that employers are going to continue to buy Cadillac insurance plans knowing that the tax would be passed on to them. They're absolutely not going to do that. The tax in the House bill is on the wealthiest 1.5%. These are the people who can best afford to help pay the cost of health care. This is not to say that they have an obligation, but they can best afford.
The House bill is
That's
a bill
where
that
the money is
over the $900 billion line that this president declared.
Look,
yes,
Douglas
it is.
Elmendorf has said he doesn't know. Okay,
they put out a scorn.
And the senior
rewrite history.
Senior analyst.
I think this is important.
May I interrupt you both?
I think this is important. The House bill is there.
I can't interrupt either.
It's a show.
You're just the host. The House bill's not going to pass, so we've got to talk about the reality. This is the reality.
Can we do this? We'll go one, then two.
Right.
You first, very succinctly, please.
Okay. The senior analyst at CBO, who is in charge of marking up the plans, said yesterday in the Washington Post, we may be off by 20%. We really don't know what the numbers are, period.
That's an exercise in hope. This is an exercise in reality. The reality is expensive, goes the wrong direction on health care costs, and it's something this nation shouldn't do.
Could I ask a question?
It's your show.
Okay, thank you. What do you think about the long section on Medicare reform in the House bill? Specifically, talk about the specific points in that section on Medicare reform.
There are an enormous number of small pilots and exercises in that bill which are of the type that many analysts, myself included, believe would be desirable and believe should be the centerpiece of the right kind of health care reform, which is entitlement reform and delivery system reform first. When you get savings and don't bankrupt the bank, do the coverage expansions. That's not the bill, though.
That is the bill, and that is the heart of the bill.
May I?
Yes.
Maggie, great having you here. Doug, great having you here.
Pleasure, Lou.
Thank you for letting me
We'll have you back sometime.
Thank you very much. Thank you very much. And I appreciate the kindness. Thank you both so much. Enjoyed it.
Thank you. This has been fun.
Good. Me too. Well, the part where I got to participate. Still ahead.